Fixed prosthodontics. Fixed prosthodontics, it is a branch of prosthodontics that is concerned with the replacement and restoration of the teeth by artificial substitutes. For example, it may be a crown or a bridge that is not readily removed from the mouth. So it is any dental prosthesis that is luted, screwed, or mechanically attached or otherwise securely retained to natural teeth roots, or dental implant abutments that provide primary support for the dental prosthesis. Now we will talk about the types of fixed prosthesis. So these are crown, and there are two types of crown: partial crown and complete crown. The other one is bridges. There is also classification of bridges. We will talk later in the video. Inlays, onlays, and veneers. First we will talk about crown. What is a crown in FPD? It is an artificial replacement that restores missing tooth structure by surrounding part or all of the remaining structure with materials such as cast metal, porcelain, or combination of materials such as metal or porcelain. So now you know about what is a dental crown and about its fabrication. It will be fabricated by different materials like cast metal, porcelain, or a combination of them. In the picture below you can see there is a crown, and you also can see a partial crown. So a crown is completely and entirely covering the tooth which is being prepared for it, and the other one, it's only a part is prepared to cover the crown. So that is the partial crown. We will now talk about terminologies. It is very important terms in prosthodontics and also in dentistry. That is anatomical crown, and the other one is clinical crown. First I will talk about what is a clinical crown. So clinical crown is a part of the natural teeth that is visible in the oral cavity. Okay. Now anatomical crown is the crown that extends from the cemento-enamel junction to occlusal and incisal surface. In this picture you can see the anatomical crown, the arrows are showing, and that is from the cemento-enamel junction to the incisal surface. It is extending. That is an anatomical crown. But the clinical crown is the one which is visible in the gums to the tooth incisal surface. Now the other term is temporary crown, which is also called a provisional crown. So it is an artificial crown made and used temporarily to protect the prepared tooth till cementation of the final crown. Now we'll talk about the classification of crown, which is one of the prosthesis and fixed partial denture. So it is, number one is complete crown. Now and the partial coverage crowns. So partial coverage crowns are classified according to retention. First one is according to retain by pins, that is pin ledge and reverse retention retainer, and the other one is that is retained by grooves, and these are 3/4 crown, reverse 3/4 crown, McBoyle retainer, 7/8 crown, and 1/2 crown. Third one is inlay, onlays, and laminate veneers, that is direct and indirect. Now first we will talk about a complete crown. So complete crown is the one that covers the entire clinical crown and retained by complete encircling the preparation. So this crown is divided according to the material of construction, that it may be made up of metallic like gold and metal. So in this case, if a crown which is made up of gold and metallic, it is a full cast metal crown that covers the entire clinical crown of the posterior teeth to restore anatomy and function. And the other one you can see is the ceramic crown. So it is a non-metallic crown and is also a full coverage crown that is encircling the preparation. Okay, so in ceramic, which is a non-metallic crown, it covers the entire clinical crown of the anterior and posterior teeth to restore anatomy, function, and the most important is aesthetics. So, let's move on. Partial veneer crown. Now, the partial veneer crown is a crown which covers only a part of the crown. It is different from the full veneer crown because full veneer crown covers the crown entirely. That is the difference between partial and complete veneer crown. So now we will talk about the classification of partial veneer crowns one by one. So first one is a partial veneer crown which are retained by pins, that is pin ledge. So we will talk about first one is pin ledge retention retainer, or we can call it pin ledge retainer. So it is a modified type of anterior 3/4 crown that obtain its retention from 3 parallel pins, that is 2 incisal and 1 cervical, in the lingual or palatal surfaces of the clinical crown. The other one is reverse retention retainer. In reverse retention retainer, it is also a modified type of 3 to 4 crown which extend to the labial surface of the tooth. Its retention is derived from the grooves placed at the labial surface. Okay, so now you can easily differentiate what is the difference between pin ledge retainer and reverse retention retainer. In pin ledge, the crown is getting retention from the lingual surface with the help of 3 pins, while in reverse retention retainer, the retention is gained from the labial surface with the help. Now we will talk about the partial veneer crown that are retained by grooves. These are 3/4 crown. Okay, so a 3/4 crown is a crown that restores the occlusal and 3 of the 4 axial surfaces, not including the facial surface, and it is retained by proximal grooves. So in the picture you can see the 3/4 crown, okay, and the only surface which is not covered is the facial surface, while all the other surfaces are covered. While in case of reverse 3/4 crown, it is also a modified form of 3/4 crown which restore all surfaces except the lingual surface, that is retained by proximal grooves. So now you can easily differentiate that the only difference between 3/4 crown and reverse 3/4 crown is of the surfaces. In 3/4 crown, the facial surface is not covered, while all the other surfaces of the tooth are covered. While in reverse 3/4 crown, the lingual surface is not covered, while all the surface of the tooth are covered. Now we will talk about other types of partial veneer crown that are retained by grooves. So these are 7/8 crown. In 7/8 crown, it is a modified type of 3/4 crown, and it is covering all the surfaces except the mesiobuccal cusp of maxillary molars, and it is retained by buccal and mesial grooves. So in the picture you can see in 7/8 crown, all the surfaces are covered except the mesiobuccal cusp. So of course it is a partial veneer crown, and the retention is gained by buccal and mesial grooves. The other crown is 1/2 crown. In 1/2 crown, it is also a modified form of the 3/4 crown, and it restores the occlusal and mesial surfaces as well as the portion of the lingual and buccal surfaces, and it is retained by buccal and lingual grooves. You can see that the L is showing the lingual groove and the B is demonstrating the buccal groove. Okay, so McBoyle crown is a partial coverage crown, and it is also retained by grooves. It is a modified type of the 3/4 crown, with its retention derived from grooves at the labio-proximal line angles. You can see in the picture, it is usually used for mandibular anteriors. We will differentiate each of them. So first one is 7/8 crown. 7/8 crown, the only surface which is not covered is mesiobuccal cusp, while in 1/2 crown, the surfaces are partially covered, that is lingual and buccal surfaces. And in McBoyle crown, the anterior lower incisors are partially covered. Okay, in case of retention, these all partial veneer crowns are retained by grooves. Move on. Onlay is another type of fixed dental prosthesis. So it is a restoration that covers one or more cusps and adjoining occlusal surfaces or the entire occlusal surface and is retained by mechanical or adhesive means. You can see the orange color is demonstrating that it is a restoration, and that is onlay, and it is restoring the cusps and also the occlusal surfaces entirely. The other one is inlay. So, inlay is a fixed intracoronal restoration. It covers the space between the cusps of the teeth. You can see the molars and also a premolar. Okay, but the second molar is covered entirely. That's its occlusal surface is entirely covered by onlay. Now you can easily differentiate between inlay and onlay. So let's review them one by one. So what is the difference between inlay, onlay and crown? You can easily tell. Crown is a restoration which covers the entire surface of the tooth. Okay, so onlay, it is a restoration that covers the cusps and also the occlusal surface of the tooth. But inlay is a restoration that covers the space between the tooth, and it is an intracoronal restoration. It does not include the cusps of the occlusal surface. Now we'll talk about the other type of prosthesis in fixed partial denture, that is a bridge. It is also called 3-unit FPD. Okay, another type of fixed prosthesis. So these are also called laminate veneers. Okay, it's a conservative alternative to full coverage for improving aesthetics. It is a thin layer of cosmetic material, that is ceramic or resin, that is covering the facial surface of the tooth, and then they are bonded to edged enamel with resin cements. In the picture you can see